Welcome to Osteology classes of thorax. In today's session, I am here to explain about sternum. So what you are seeing here in this image, it is the image of thoracic cage where you can see anteriorly an elongated flat bone which is present in the anterior median part of the chest wall known as sternum. So sternum, if we see its length, it is approximately around 7 centimeters. Parts of the sternum is a flat bone consisting of 3 parts: manubrium. So the upper part, which is the sword, like handle of a sword, the sternum appears to be like a sword-like bone, where the handle is formed by the manubrium. Manubrium is otherwise called as episternum or manubrium sterni. The middle part is formed by the body of the sternum, which is the mesosternum. This is the body. Whereas the lower part, that is the lower tip of the sternum, is called as the Xiphoid process or metasternum. The sternum resembles a dagger or a small sword in shape. Its 3 parts, that is the manubrium, body and Xiphoid process, represent the handle. So manubrium represents the handle, and sternum the blade, and the point of the sword is formed by the Xiphoid process. The upper wider part of the sternum is broad and thick, whereas its lower part is thin and pointed. Its anterior surface, here is the lateral view of the sternum where you can see the anterior convexity. So its anterior surface is slightly rough and convex. While its posterior surface is smooth and slightly concave. So the manubrium, here is the manubrium. So the upper part of the sternum, we know it is called as the manubrium, and it has the superior margin made of jugular notch and clavicular notch for each clavicle present on the either side of jugular notch. So it also articulates with the cartilage. So manubrium also articulates with the cartilage of the first rib, the upper half of the second rib. So cartilage of the first rib, and here. So cartilage of the second rib, upper half of the cartilage of the second rib articulates at the junction between the manubrium and the body of the sternum. So the junction between the manubrium and the body of the sternum makes an angle which is called as sternal angle or Lewis angle. So this point, so here we can see this is the long axis of the manubrium, and here is the long axis of the body of the sternum. So this angle is the sternal angle. So we can see a slight bend between the manubrium and the body of the sternum. So this angle is approximately 163 degrees. So this angle increases slightly during inspiration and decreases during expiration. The angle between the long axis of the manubrium and the long axis of the body of the sternum. So if you make this intersect these two, so this here we can make it out to 17 degrees. So that is also considered as sternal angle. Let's see the features and attachments of the sternum. So first, with the manubrium, it lies opposite to the third and fourth thoracic vertebra. So here we can see this is T1, where the first rib articulates with the first thoracic vertebra. Then here is the T2, T3. So you can see the upper margin of it is at this level, T3, T4. So manubrium lies anterior to the T3, T4. So it is lying at the level of T3 and T4, and it is the thickest and strongest part of the sternum. So let's see the external features of the sternum, that is the manubrium sternum, where the two surfaces, anterior and posterior surfaces are there, and manubrium has got the four borders: superior border, inferior border, and right and left lateral borders. So the anterior surface on each side provides attachment to sternal head of 𝗠𝐞𝐫𝐢𝐴𝐺 muscle. So anterior surface on each side provides origin to 𝗠𝐞𝐫𝐢𝐴𝐺 muscle. And also it partly gives origin to pectoralis major muscle. So these two muscles gets origin from the anterior surface of manubrium. And here is the image of the posterior surface of the sternum. So posterior surface of the manubrium is smooth and forms the anterior boundary of superior mediastinum. So here we can see this is the anterior surface of sternum, and here is the posterior surface, and we can appreciate the posterior surface forms the boundary of superior mediastinum. It forms the anterior boundary of superior mediastinum. Let's see the attachments on the posterior surface. On each side, manubrium provides attachment to two muscles, sternohyoid and sternothyroid muscle. Sternohyoid gets origin at the level of clavicular notch. And the other muscle is the sternothyroid, which gets its origin at the level of the facet of first costal cartilage. So here is the facet for the first costal cartilage. And here is the facet for clavicle, clavicular notch, where the clavicle articulates, and the upper border is the jugular notch. So we can see the origin of sternothyroid, which is present at the level of clavicular notch. So sternothyroid, we saw its origin at the level of facet of the first costal cartilage. So at the level of the first costal cartilage, we saw the origin of sternothyroid. And manubrium, on the posterior aspect, it presents a notch called as suprasternal notch or jugular notch, which is present along its superior border, and it provides attachment to interclavicular ligament. So this notch provides attachment to interclavicular ligament attaches to the borders of the jugular notch, and clavicular notch on either side of the suprasternal notch or jugular notch articulates with the clavicle to form sternoclavicular joint. So lateral border presents two articular facets. Upper facet articulates with the first costal cartilage to form primary cartilaginous joint. So here the first costal cartilage, where it articulates with the first costal cartilage to form primary cartilaginous joint, whereas the lower demifacet along with the other demifacets in the body of the sternum articulates with the second costal cartilage. So here, so this part articulates with the second costal cartilage. The lower border articulates with the upper end of the body of the sternum to form secondary cartilaginous joint called as Manubrium-sternal joint. This joint is the sternal joint. The manubrium makes a slight angle with the body at the junction called as sternal angle or angle of Lewis, which we saw just now, and it is recognized by the presence of transverse ridge on the anterior aspect of the sternum. So the sternal angle is marked by transverse ridge which is present here on the anterior aspect of the sternum. Next we shall move on with the body of the sternum. The body of the sternum articulates with the costal cartilages of ribs from 2nd to 7th costal cartilages. So already we know part of the 2nd costal cartilages articulates with the manubrium and rest of the lower part articulates with the upper part of that is the body of the sternum. So on either side we can see the notches where it articulates with the 2nd to 7th costal cartilages. So its upper end articulates with the manubrium and sternal angle to form Manubrium-sternal joint. And the body also articulates with the Xiphoid process to form Xiphi-sternal joint, which is present at the level of T9. So here is the Xiphi-sternal joint. So which is present at the level of T9. Its anterior surface presents 3 faint ridges indicating the lines of fusion of 4 small segments called as sternebrae. We can see the faint ridges. So these faint ridges represents the sternebrae. So during development, the sternum develops in the form of segments which are called as sternebrae. The anterior surface on each side provides origin to pectoralis major muscle. So pectoralis major muscle partly gets origin from manubrium and also it gets origin from the half of the body of the sternum. Now let's talk about the posterior surface of the body of the sternum. So posterior surface it provides origin to the sternocostalis muscle. So the lower part of the posterior surface of the body sternocostalis muscle. And if you see the relations on the posterior surface, on the right side of the median plane, posterior surface is related to the pleura which separates it from the lungs. That is the right lung. On the left side, the median plane, that is the upper half of the body, is related to the pleura and the lower half is related to the pericardium, which is the bare area of pericardium. So if you see the lateral border of the sternum, it articulates with the 2nd to 7th costal cartilages. So this is first. Here is the first costal cartilage, 2nd, 3rd, 4th, 5th, 6th and 7th. So we can see the body of the sternum partially articulates with the 2nd and continues with the 3rd, 4th, 5th, 6th and 7th is also at the junction between the body and the xiphoid process. So to form plain synovial joints. So these joints are plain synovial joints. So strictly speaking, the 2nd costal cartilage articulates with the side of Manubrium-sternal junction and 7th costal cartilage articulates at the Xiphi-sternal junction. The first sternocostal joint is 𝐒𝐮𝐬𝐫𝐢𝐻𝐿, where the joint since the cartilage directly articulates with the manubrium. So the first sternocostal joint is 𝐒𝐮𝐬𝐫𝐢𝐻𝐿. Now let's talk about the Xiphoid process. Xiphoid process is a flat cartilaginous process at birth that ossifies slowly from the central core and unites with the body of the sternum at the age of 40 years. It can be palpated in the epigastrium. So here is the Xiphoid process. So Xiphoid process can be palpated in the epigastrium and attaches to the diaphragm. So it provides attachment to the diaphragm and abdominal musculature via the linea alba. So it is the lowest and the smallest part of the sternum, and it varies greatly in size and shape. So sometimes you may find the Xiphoid process is bifid or perforated. So its anterior surface provides insertion to the medial fibers of rectus abdominis muscle. The posterior surface. So here is the image of the posterior surface. So the posterior surface of the Xiphoid process gives origin to sternal fibers of diaphragm. And its tip provides attachment to linea alba, that is the upper end of linea alba. So its tips provides attachment to the upper end of the linea alba. So sternal angle can be felt as a transverse ridge on the sternum approximately around 5 cm below the suprasternal notch. So here is the Manubrium sternum, and here is the body of the sternum, and we know this angle is the sternal angle, and here is the suprasternal notch. So just 5 cm below the suprasternal notch is the sternal angle, and the sternal angle is considered as a significant surface body landmark for many anatomical events which accurately happen at this level. So what are the structures related here are like second costal cartilage articulates on either side with the sternum. So here is the facet for second costal cartilage which is present on the either side of the sternum. So hence this level is used for counting the ribs, and first rib cannot be palpated because it is present below the clavicle. So often surgeons start counting the ribs from the second rib onwards, that is from sternal angle onwards. It lies at the level of intervertebral disc between T4 and T5 vertebra. So here is T1. So we can see, we can draw an imaginary line which is towards between the T4 and T5 vertebral level. So this horizontal plane passing through this level separates the superior mediastinum from inferior mediastinum. So this is the superior mediastinum. So below this imaginary plane is the inferior mediastinum. And sternal angle is related to the ascending aorta, ends at this level. Arch of aorta begins and ends at this level, means arch of aorta ends at this level which continues to form descending aorta. So descending aorta begins at this level, and we can also see the trachea which bifurcates into right and left principal bronchi at the level of sternal angle. The pulmonary trunk divides into right and left pulmonary arteries at sternal angle, and we can also see the upper border of the heart lies at this level. 𝐒𝐽𝐵𝐽 vein arches over the root of the right lung to end in the superior vena cava. The sternum develops from two vertical cartilaginous plates, that is the sternal plates, which fuse in the midline. So if we see the ossification of the sternum ossifies from 6 double centers. Let's see the ossification of the sternum. The sternum ossifies from 6 double centers, 1 for Manubrium, 4 for the body, and 1 for the Xiphoid process. So let's see how these centers appear. So the centers appear in descending order for different parts. So first, if you see for the manubrium, so manubrium and the body, usually the primary centers appears during 5th month of intrauterine life. The first sternabrae, it appears during 6th month of intrauterine life. Then second sternabrae, which appears during 7th month, and the third sternabrae appears during 8th month, and fourth sternabrae appears during 9th month. So lastly, the xiphoid process, the ossification center for the xiphoid process appears during the 3rd year after birth. So let's see the fusion. The fusion between the sternal plates takes place from below upwards, means it begins at the puberty and it is completed by 25 years. The xiphoid process fuses with the body at the age of 40 years approximately. Manubrium does not fuse with the body. As a result, the secondary cartilaginous joint, that is the secondary cartilaginous manubriosternal joint, usually persists throughout the life. So in about 10% of individuals, the fusion occurs in older age. So let's talk about some applied anatomy associated with the sternum. So the first clinical correlation is sternal puncture, where the manubrium sterni is preferred site for bone marrow aspiration. So because it is subcutaneous and readily accessible. The bone marrow sample is required for hematological examination, and a thick needle is inserted into the upper part of the manubrium to avoid injury to the arch of aorta, which lies behind the lower part. The sternal puncture is not advisable in children because in them the plates of the compact bone of sternum is very thin, and if needle passes through the manubrium, it will damage the arch of aorta and its branches, leading to a fatal hemorrhage. The next clinical correlation is the mid-sternotomy. To gain the access to the mediastinum for surgical operations on heart and great blood vessels, the sternum is often divided in the median plane, called as mid-sternotomy. The sternum possesses hemopoietic marrow throughout the life and is common site for bone marrow biopsy too. Let's talk about the funnel chest. Funnel chest is otherwise called pectus excavatum. It is an abnormal shape of thoracic cage in which the chest is compressed anterior-posteriorly and sternum is pushed backwards by the overgrowth of the ribs and may compress the heart. So that is about the funnel chest. The next deformity is the pigeon chest. Pigeon chest is called pectus carinatum. It is an abnormal shape of thoracic cage in which the chest is compressed from side to side. So where the anterior posterior diameter increases and the sternum projects forwards and downwards like a keel of a boat. So the next point is on sternal fracture. It is a common in automobile accidents, that is in road traffic accidents, when driver's chest is hit against the steering wheel. The sternum is often fractured at sternal angle. So the backward displacement of the fractured fragments may damage aorta, heart or lungs and cause severe bleeding, which may prove fatal. So next about the interchondral joints, the joints between the 7th rib and 8th, 9th, 10th rib. So here is the 7th rib, this is the 8th rib, 9th rib and 10th rib. We can see each rib articulates with the preceding rib. So these joints are synovial joints. So they are plain synovial joints. And manubriosternal and 𝐒𝐵𝐼sternal are secondary cartilaginous joints. So manubriosternal is here and 𝐒𝐵𝐼sternal, they are the secondary cartilaginous joints which are like symphysis joints. So this completes the osteology of sternum. Thank you.